This is Doctor Talks, real talk from real doctors on the issues that matter to you most.
Well, I know everybody's as excited as I am, and I am really excited, and I'm high energy even when I'm not excited, to have the amazing and the great and the world expert Michael Greger, the author of the how-to books. It's not how to fix your car, it's how to fix your body books. It's so good, and I'm actually holding one of them just by chance. There's somebody in the world doesn't know about how not to die and how not to diet and how not to age, with another book coming up. Always is the term Dr. Greger just used. Thank you, Dr. G.
Happy to be here. I'm always looking for ways to support your great works.
Thank you. That's kind. I know you're standing. You're not walking right this minute, are you?
Well, I can turn it on. I just everyone always complains I make them seasick.
Well, you're welcome to, if you need it for your 38,000 steps a day, go for it.
Well, I'll try not to make people nauseous.
I am standing. I
Nice.
used to have an under desk treadmill, and then I decided because of patient feedback, they didn't want me swaying like I was on a boat back and forth. And I kept spilling things anyways.
Yeah.
And an interesting new study actually said, when you sit all day, you certainly promote cardiovascular disease. But when you stand all day, you don't prevent it. You just end up neutral. And they talk about, issues with varicose veins. I stand about 7 hours a day. I mean, I'm a big fan of getting off your bottom as much as possible. But
I'm with you.
Yeah, absolutely. So let's talk heart disease, Reversing Heart Disease Naturally Summit. Maybe this is an oddball question, but you're in your early 50s. We were just celebrating your birthday. It's one of my favorite days of the year when everybody should donate to nutritionfacts.org and have a nice giant arugula salad with a candle in it or something.
You make me hungry.
What do you do? And you can, be as personal or as sort of vague about it, but what do you do to prevent heart disease in Michael Greger's body? Because, you are here on the planet with us.
Oh, diet since 1990, since Ornish's Lifestyle Heart Trial. I've been trying to eat healthy, centering my diet around whole healthy plant foods. I encourage people to eat primarily plant-based, not necessarily exclusively plants. Plant-based diet is really more about getting people to maximize the intake of the healthiest foods out there, right? As physicians, we realize that, labels like vegetarian and vegan just tell us what you don't eat. I mean, do you actually eat vegetables? And of course, it doesn't matter what you eat on your birthdays, holidays, special occasions, the day-to-day stuff that adds up on a day-to-day basis really should center our diets around natural foods from fields, not factories, unprocessed plant foods.
Okay, well, that would be a good protective shield. We already mentioned you're obviously famous for walking a whole heck of a lot while you work. Have you ever calculated how many steps a day you get on a busy day at the desk?
Well, so it comes out to like 14 miles. I don't know how many steps that is.
Wow, it's about 5,000 steps a mile. So that's, help me, Lord, 70,000 steps, the world record, other than maybe a postal.
It's very slow. It's like 2 miles an hour. So I'm not even getting my heart rate up. So it's really just not being sedentary more than actually any exercise.
Yeah. Do you own a home blood pressure cuff, or when you do visit my
blood pressure is perfect, but and part of that is from sodium restriction and eating healthy foods. But if I did have problems with blood pressure, I would check it more frequently.
Now I'm thinking for a minute. It was your grandmother at the Pritikin Center, right? Of course.
Yeah. Oh, absolutely.
Absolutely. With Nathan Pritikin in the 70s.
70s, yeah, late 70s.
So I was going to ask you if there's any family history of cardiovascular disease in the Greger clan, but obviously
there is indeed. Yeah,
parents too, or parents not?
Parents not. Okay. Parents not. But dad Parkinson's, so that's something to worry about. Maternal grandma Alzheimer's. I had a pancreatic cancer in the family, paternal grandfather.
Well, The sad truth is, even the healthiest person in the world does leave the world at the end. We haven't yet matched Methuselah for longevity, so we have to pay attention to our family history and genetics too.
Sure.
Again, I'm going to just ask one or two more Michael Greger specific questions. Do you actually get blood work about once a year?
I should. It's actually it's on my list. The problem is I live in the middle of nowhere these
Right.
days. And so I mean I'm overdue for the dentist. I'm overdue like for all the kind of
Michael,
standard stuff. I
Michael.
know.
We're gonna
I know.
edit this. We're gonna edit this right out because you have to be perfect. People are
No,
watching
no,
you.
it's just it's just to get into civilization. It's a,
Okay.
yeah. I mean, see, if I was forced to get groceries, but now with like Instacart and stuff, like literally, I don't have to take my jammies off or anything, and so it's just hard to get in. And you know, I haven't been traveling since the
Right.
once the book tour ends. Now I can really kind of get into deep work mode.
Yeah.
And so, yeah, some of these things I've got to catch up on.
Well, next time you wander through Detroit, or I do have a clinic 2 months a year in Boca Raton, Florida, January and
Nice.
February. You are an honored guest, and
Ah, nice.
we'll go head to
Nice.
toe, and
Yeah, yeah.
even run that fancy advanced glycation end product scanner. I was just
Ooh, oh, now you're getting me
now you
excited.
get
How much?
excited.
How much is that monster?
It's about $6,000 machine.
Okay. All right.
I'm not charging. Just if since people listening don't know what the heck we're talking about.
So
there is a
cool.
machine from Europe.
So cool. Yeah,
is-
I mean, so you can measure advanced glycation end products in the blood, but it changes based on what you just had a meal.
Right.
Whereas the buildup in the skin
Which is
gives you a
this
better
chronic
sense of
level.
kind of
Yeah.
long term.
Yeah.
Yeah. So super interesting.
It is.
Now,
I'm not-
yeah,
I'm finding it so interesting. I'm not charging patients. It takes 25 seconds. I can't
Yeah.
exactly, put a big price tag on it. I just bought
Yeah.
the machine because it's such an interesting scientific.
So cool. Yeah, unfortunately not. Some of the most dangerous AG is actually not autofluorescent. And so you're getting kind of a subset.
How do you know that? You're right. The methyl glycoxyl
Right.
is
So,
not
but
a fluorescent product.
but presumably they're traveling in similar foods, and so I mean it gives you a sense. So certainly, yeah, it really fascinating field.
Although not surprising, but I'll give it up to the fact that you are up to date because that is the one limitation. But there is no lab I can find that offers the blood levels. They do it in research studies, but
Right.
So I want to know, and the last question I don't want you to answer is what's your coronary artery calcium score? But when you're in Detroit or when you're in Boca Raton, I'm going to nail you in a CT scanner for about
Let's do
5
it.
seconds. And maybe we can hook a treadmill up to the CT scanner and you can walk your way right in there. But,
There we go.
and they make me director of cardiac health for the new MAHA movement. Everybody gets a calcium score at age 45 or 50.
There we go. All right.
All right, so you've got a chapter in How Not to Age called Preserving Your Circulation. Thank goodness nobody talks about heart disease, the big elephant in the room, literally. So you have such wonderful subchapters. A normal cholesterol is a deadly cholesterol. And in fact, I trained with William Roberts, the world famous cardiac pathologist that you quote. And of course, he was editor. He just passed at age, I think, 95. God bless him. He was editor of the American Journal of Cardiology. And man, when you submitted a research paper, red ink everywhere. He was a cruel editor, but he was awesome and always admired him. He used to say, "We kill the cows and the cows kill us," which is a quote you can put in your next book. But you talk a little bit about populations that genetically are born with a defect, like a PCSK9 variant, and they whole life have a low LDL cholesterol. That's got to be bad for you because you need that cholesterol for your brain. Tell us what happens to these lifelong low LDL cholesterol people.
What they get is what are referred to as longevity syndromes. And that's one of the ways we know that the relationship between LDL cholesterol and heart disease is cause and effect. Because people, regardless of what they eat, if they are just born with a genetic predisposition to have a low LDL cholesterol their entire lives, what happens to them is they live longer, they have less cardiovascular disease. And so that's where we got the whole idea for these PCSK9 inhibitors is, well, wait a second, if we can tinker with the same gene pharmacologically, maybe we can get the same kind of benefits. What's interesting about those studies suggests that this sense of cholesterol years, just like we have, pack years for smoking. It's not just do you smoke or do you not smoke or how much do you smoke, but how much do you smoke and for how long do you smoke? There's this kind of building up of risk, such that you get a sense with pack years of how many packs a day have you been smoking for how long. Similarly, there's this sense of, well, really cholesterol years matter. How, not only what's your LDL cholesterol, how high is it, but for how long has it been high? And that's why what's remarkable about these longevity syndromes is that their LDL really isn't that low. One would expect. So you get your LDL, if you have a lifelong LDL under 100, you can get the kind of remarkable benefits that you would get later in life trying to shove your LDL down to 70, for example, for primary prevention, or down to 30 or lower for secondary prevention. And so if you don't get on the train till later in life and you've been, building up this plaque and inflammation in your arteries, then you really have to shove your LDL extraordinarily low to get the same benefits you would get from a lifelong of a more moderate LDL. And so that's why when you see these populations, like in sub-Saharan Africa and rural China, that do not have, or historically have not had, epidemic heart disease, and you're like, wow, I bet their LDL was like 15 their whole lives to get that low rates. But no, it actually wasn't that low. But it's because it wasn't that high their entire lives that you don't get that build up across the population scale.
Yeah, in fact, one of the most esteemed cardiologists in the country is Eugene Braunwald, chairman of the Department of Cardiology in the Harvard Medical School system. He's like 96. He's been publishing since the 1950s, and he published a paper in the summer of 2024, and the term he uses is plaque years. How high was your cholesterol for how many years is your cumulative risk for blocked arteries? So we should be teaching kids and teens and young adults to live a lifestyle of Michael Greger's diet. There's no doubt about it. The daily dozen and healthy measures, right? I'll even throw in a few G-bombs here and there for our mutual friend, Dr. Furman, a wonderful guy. So the problem with these people that have this genetic inheritance where they run a lower LDL their whole life is they don't get to be on statins, apparently. They don't develop heart disease. You did a pretty nice job. How effective are statins? How safe are statins? Reggie's rice. Do you think it should be in the water, or do you think we shouldn't put statins in the water?
The biggest concern is diabetes risk. And so, if statins didn't contribute to diabetes, I think, many of these muscular complaints are really overblown and kind of a nocebo effect. When you actually take people who claim they have these muscular symptoms to statin drugs and you actually randomize them to placebo or not, week by week, often people cannot tell whether they're actually on statins or not. But yeah, the increased risk of diabetes, just because diabetes can be so devastating in terms of increasing risk, for blindness and kidney function and kidney failure and lower limb amputations on down the list, that from a population scale, I wouldn't want to bump it up. Now, of course, diabetes is down like killer number 6, heart disease killer number 1. And so look, if you had to take then it's not even a competition. But if there was a way we could decrease risk both of heart disease and type 2 diabetes at the same time, that would be a preferable option. And you can do that with lifestyle.
What the heck does that?
A healthy enough lifestyle, and you can treat the underlying cause of both those conditions, which is raised LDL cholesterol and insulin resistance.
Yeah. And I got to say, as I still have a very busy practice. I see a lot of mild hyperglycemia, elevated blood sugar, elevated hemoglobin
Yeah.
A1C in people on statins. And there's ways to get around it, but by reducing the dose and or teaching lifestyle and maybe getting them off. I actually stopped a patient's atorvastatin 40 milligram today because he has no heart disease, and we don't treat with chemotherapy if you don't have cancer. So I don't believe you treat with statins when you have no heart disease. Of course, I did the appropriate test. He has terrible low back pain. I'm very curious if
Huh.
he's going to call me in 3 weeks and say miracle worker, but I don't know that's a fact. So
Hmm.
you go on. I'm a formally trained and board certified interventional cardiologist. Maybe 10,000 stents in my history, but it's been a decade back. And you have a subchapter called the Great Stent Scam. And frankly, I own the trademark Prevent Not Stent. It got me in trouble at my hospital long ago. But tell us your perspective on, wildly placing stents, which is pretty simple to do. But why are you not a fan?
Yeah, well, so in emergency settings, stents absolutely can be life-saving,
Right.
but otherwise may do more harm than good. And we know this from these remarkable studies where they did sham surgeries. You want to talk about, it's easy to give somebody a placebo pill if you're, testing a medication, but how do you do a placebo surgery? Well, you literally can, cut into somebody and shove a catheter up, and at the last minute, eject a stent or not. And and people, they have the wound, they went through the thing, and then they like have this miraculous alleviation of their angina, and they say the stent was amazing. I'm going to invest in this medical instrumentation company. When it turns out they're in the placebo group and that they actually never got a stent at all. Actually, angina is really remarkably susceptible to placebo effect. And I forget the exact number. There's a number of things. Osteoarthritis, some things that are less susceptible to placebo effects, but there's certain things like angina that you really have to make sure that you discount that. And the same thing goes with lifestyle interventions. You put someone, radically change the way they're living, the way they're grocery shopping, the way their entire family's eating, and all of a sudden they're feeling better. Actually, how much of that is, particularly early on, yes, maybe it's some improvement in artery function. You're certainly not affecting the structure of the arteries at that early stage. And so, yes, maybe you're getting a little more nitric oxide or something, but part of that may be a placebo effect, whatever keeps people on the program so they actually are staying on it long enough to get the long-term proven benefits, whatever it takes. But when, Ornish says, look, 80% drop in angina, well, if you just gave people a sugar pill, I forget what percentage drop you get in angina, but it's really, it's not trivial.
I agree with you. And my general approach to patients who see me in the clinic, do I need a stent, is if you were healthy enough to be discharged from the hospital, the emergency room, or the cath lab to consider what's going to happen, you're healthy enough not to get a stent. And we've got, the lifestyle heart trial and Dr. Esselstyn's experience, and the Orbita is the randomized sham study out of England, one of the boldest, craziest studies. And of course, we actually
so controversial. It was like they were accused of Nazi doctoring, human experimentation.
Right.
Until, of course, the results came out and it's like, yeah.
And we got that monster trial called the ischemia study with over 5,000 people with bad heart disease, either randomized to an early stent or bypass or watched on good medical therapy and an average
Medical
diet.
therapy.
And there was no benefit at 3.5 years. So I agree with you. As you said,
and it's not just always a waste of money and time, but there are rare serious complications that
like
can
death.
occur.
Like
And
death.
yeah, well, the minor ones too. Yeah, okay. Yeah, and when you do millions of procedures, you're
Right.
going to end up with some really tragic cases. That is, if the risk benefit equation worked, is totally understandable. That's what medicine is all about. But if there actually isn't the benefit that people are being sold on, then it's really scandalous.
I totally agree. People do sign an informed consent form, but that doesn't mean they really expect at age 48, having played golf yesterday, to come out in a pine box. And it does happen, even in the hands of qualified, competent people, but sometimes not so competent and qualified. Well, let's go to the topic here about Doc. I don't want to eat vegetarian. I hear they have more strokes and more bleeds in their brain. And I saw a carnivore tell me that the vegetarians are dropping from stroke risk. So where is Dr. Greger on that nugget?
Yeah, so the Epic Oxford study found increased risk of hemorrhagic stroke. Now, it actually found decreased risk of cardiovascular disease overall, but that's because the drop in heart disease risk overwhelmed the increased risk of hemorrhagic stroke. So if you're worried about cardiovascular disease, even based on that worrisome study, you'd still want to be eating that way. But it certainly raised the question, particularly looking at the risk factors associated with stroke. You'd think, you would expect, having lower blood pressures, et cetera, that we would see a decrease in risk. And so that led us to think, what are we missing here? So I did a whole series, uselessly, I did a whole series of videos talking about, the various hypotheses as to why that might be the case, until, of course, what happened is, once that study was published and was so kind of shocking to everyone took their cohorts that they've been following. The Harvard folks looked at their cohorts. Everybody looked at that, and they already had the data, and they were like, okay, let's drill down and see. So there's been 5 studies done so far since then, and you put them all together, and turns out vegetarians have lower stroke risk overall. And that the Oxford vegetarian result appears to be a fluke. And so it turns out I wasted a lot of time digging into the hypotheses, but we should not take for granted. We should not just assume that, kind of one and done, that we kind of have the answers and that we know what's healthy. Nutrition is a dynamic, exciting field. Things are changing all the time. And if we need to eat something different, we will eat something different. I just did a deep dive into taurine. This landmark study on showing extraordinary health span and lifespan benefits of taurine supplementation in laboratory animals. Yeah. actually came out. It was actually published after I had submitted my manuscript for How Not to Age. And so only now am I able to go back and do the deep dive necessary. And so February, I'm going to be doing a webinar whether we all should be supplementing with taurine. It's very interesting. Kind of like the spermidine story, where yes, our body makes it, but there's a decline in our body's ability to produce it, and whether restoring youthful levels will have beneficial effects. What are the pros? What are the cons? What's the dosing frequency, source, et cetera, et cetera. Really fascinating story. And that's the kind of thing where one study can really set us down a different path and really change how we look at things.
I'm crossing out the commercial name because we're not doing a product sales pitch here, but this is a little powder I personally take that has taurine and spermidine.
Okay. Oh, there we go.
It's actually very, very inexpensive, and no, we don't know for sure.
Yeah, no, a gram of taurine costs a penny.
Yeah.
It's absolute dirt cheap stuff. And so it's convenient, it's cheap. The question is it safe? What are the downsides? Blah, blah, blah. Are there contraindications? Super exciting, very interesting. People eating strictly plant-based diets have about 20% lower taurine levels. We didn't think that had any clinical implications, but we didn't really look into it. And now that we're looking into it, we may have to change our mind. So it's just an example of, we can't sit on our laurels, and we have to constantly, keep an eye out for ways to make things even better.
Yeah. And as you have mentioned in your lectures since your book on How Not to Age, wheat germ is a source of spermidine. I'm not sure. I need to research what's a natural source of taurine that's in the plant world, because it is richer in some animal products. So, studies will ongo whether this is a cheap, reasonable supplement. It does tend to support a healthy blood pressure too. So a lot of people need that help anyways. All right, let's
Yes, right. Right. We have to have good RCT human data on blood pressure reduction. Yeah.
One more topic, the old fish tail. My cardiologist told me I should be taking fish oil every day. Even if I'm a vegan, I need fish oil. And that's, a raging controversy between Dr. McDougall camp, God bless his soul, Dr. Furman camp, but it's also in the middle of the cardiology world. So what did your analysis lead you to conclude about routine omega-3 supplements from fish oil?
Yeah, I mean, so it's really an interesting story going back to the original DART trial showing this remarkable reduction in cardiovascular risk. People don't forget about the DART-2 trial, of course, which is even bigger, showed opposite results. Basically, you look at the latest meta-analysis of any kind of controversial question, latest Cochrane review of finding that high-dose fish oil supplementation or advice to eat fish does not appear to reduce cardiovascular risk. If anything, the only omega-3 they found associated with lower risk was ALA, alpha-linolenic acid, which is kind of like the short chain omega-3 found in, walnuts and, flax seeds and hemp seeds. And so yeah, I mean, so it appears to be a fishtail, although it birthed this massively profitable, fish oil industry. And so I talk about these latest, and it birthed some really good trials, right? So we had these small trials, which kind of flopped back and forth. And then we just had the publication, 4 or 5 massive trials where we randomized people. And they all universally flopped except one, which used as their control group. They gave people mineral oil, which has its own negative properties. And so when you see benefits, it's kind of it's been accused of kind of using a standard kind of big pharma trick of, pitting your product against something that's known to be substandard to make your product look a little better. Right. That's the only one that suggested any benefit. And so we're really at this point, the science really seems to be tipping away from routine supplementation of omega-3s.
Okay. Well, I think we've covered, 5, 6 really hot bullet points. And for the viewing audience, I think they learned a lot. I think we're going to do a GoFundMe to pick you up in rural area where you write your book and fly you into Boca Raton, and we'll give you.
Oh my God, I'd love it.
We'll give you a spa program.
Oh, that's nice. One thing I have to do is check my D levels. I had such low D levels, despite supplementation. I had like the D levels of an institutionalized elder, because I don't get outside, at all. I don't get, and but then I ramped up my supplementation. So then I started taking like 5,000 IUs a day, and actually got into toxic levels. So I gotta. So I really should follow up and make sure that I'm not doing myself harm.
I think that would be good. If you want to check your D in the D, as we call Detroit, but I'd still suggest Florida would be a better option.
That sounds good.
We got months till we see sunshine here.
All right, and let's get you in the new administration too.
All right, I like it. Maha is always a good goal, and make America's heart healthy again is certainly.
I love it.
I don't hear a lot of people talking about that. They've got other agendas which may be quite important and beneficial. I don't think we need to talk about healthier Fruit Loops. Think we need to talk about banning Fruit Loops. And
there we go.
Teach people
I love it.
Oatmeal or a nice flaxseed smoothie. But thank you for your time. We'll be looking forward eagerly. When is a new book coming out? Late 25, early 26?
Late 25.
Late 25. Well, that is soon enough that we'll all be lining up and pre-ordering it and being sure we push it to the top of the New York Times bestseller list where it deserves to be, right?
Fantastic.
All right.
Keep up the great work.
Thank you.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.